holiday season is a hot season for cosmetic surgery. Joining us now with more details is Dr. Bill Johnson from Innovations Medical. Good morning.
Good morning.
I hear that you are very busy. You're booked for the whole holidays.
Yeah,
correct?
we've pretty much been booked throughout the holidays. It's a real popular time. People can take a couple of days off from work and not actually miss work.
Okay, and what are some of the procedures that people are getting done right now?
Well, what we're seeing the very most of is tumescent or liposuction done under local anesthesia and not done under regular general anesthesia. And what's really had a real uptick the last few weeks has been fat transfer, where we take fat from one area that we liposuction and put it back in somewhere else, and that's really been on the rise.
Well, people have said that forever. I know I have. I'm like, if you could take fat from here and push it up somewhere else, and you actually can do that
That's
now.
a reality now, and it works quite well. And we do it under local anesthesia.
Wow.
Popular areas are the buttocks,
okay,
where it's a really revolutionary procedure. It does much better than implants.
Now, did you have some before and after pictures also that we can look at? Because I know that's my favorite thing to do.
We do.
Look at some of those. Okay, so tell me what we're looking at right here.
This is after a liposuction, and you can see the advantage of having, I think we're getting one at before picture. That's, there's the after.
There's the after.
There's the after. And so you can see that it's the same person, but that tummy's all gone. That's done under local anesthesia in the office. It takes about an hour, hour and a half, and has very little downtime. Most people are back to work in a day or two.
Okay, and how about as far as recovery? I mean, recovery, you said a day or two, no big deal on that?
No big deal, and really very little wound care and very little downtime. It's very safe, and that's one of the advantages of doing it. We do it in the office under local, and that really reduces the cost because you don't have to pay for anesthesiologists. You don't have to pay for the surgical center of the hospital. And at the same time, we're at least as safe, if not safer, than doing it under general anesthesia.
Now, let me ask you this. I know some people will get a gym membership as a gift, and it's always a little offensive. Have you found that people get gifts of plastic surgery? Or
We've had quite a bit. Yeah, we had more than one. We've had several patients come in with liposuction. We actually had a husband that said he was getting his wife's tummy tuck as a Christmas gift. That was her Christmas gift this year. Nice.
All right. So what are some of the health reasons that you've seen right now where people are coming in and getting?
A lot of people will do liposuction as an adjunct to weight loss. Now, it's real important to understand that liposuction is not a weight loss procedure. That said, if you're doing well and on a diet and you've lost that first few pounds and on the right trend, then you can come in and do liposuction. It really acts as a nice jump-off point and helps you see some really quick results in your problem areas.
Okay, and this is an actual med spa where you're at. What is a med spa? What does that mean?
We're doing, we really call ourselves Innovations Medical now because we do mostly medical procedures. Med spas have traditionally been involved in non-invasive laser-based or light-based procedures. And those which were real popular a year or two ago are still strong, but they're not as trendy as things that are now minimally invasive. And we actually make little incisions, but we don't do general anesthesia.
Okay. What's the hot surgery right now for 2011?
I think fat transfer is going to be the hot thing for 2011. It's already well established on buttocks. It's becoming a real trend on breast, and it's going to replace traditional facelifts or modified traditional facelifts from now on.
Excellent. All right. Well, thank you, Dr. Bill Johnson, for coming in, and always a pleasure. Scott, back to you.
Fat transfer. I've had that.
I love it.
I've had that naturally for quite a few years now. It just kind of, it's called gravity, and just kind of, all right.